Hi, my name is Nadia Carrillo-Peset, and in this video I'm going to talk about allergies and my experience with them. So allergies are your body's reaction to a foreign protein or like substance, let's say, which, by the way, anything that gives you an allergic reaction is called an allergen. So usually these allergens are harmless, but if you have an allergy to a particular protein or substance, your body's immune system overreacts to its presence, which creates the allergic reaction by producing antibodies that attack the allergen. Allergens can be inhaled, ingested, or even enter through your skin, which sounds very creepy, and they can be very specific. Like, you can be allergic to a certain type of pollen but not another one. It doesn't have to be all of them. The most common allergens are pollen, dust mites, which are like really tiny spiders that you can't even see with your eyes, and they live in the dust and in fabrics. So for example, in your pillowcase, in your mattress, in your carpet, etc. You can be allergic to food, of course, like peanuts, milk, gluten. You can be allergic to insect bites or stings, like ants, bees, wasps. You can be allergic to animals, specifically pets, I would say, are the most common ones. You can be allergic to your pet's saliva, pee, skin, fur. You can also be allergic to certain types of medicine, for example, chemotherapy drugs and insulin. And another common one is latex, like condoms and rubber gloves. There is a type of allergy called inhalant allergy, which includes substances or allergens that you can inhale. So I have inhaled allergies. And this can be classified into perennial allergens and seasonal allergens. Perennial allergens affect you throughout the whole year. So for example, if you're allergic to pets, that's year-round, and the seasonal allergens are more prominent depending on the season. For example, tree pollen appears in the spring, while wheat pollen is more common in the fall. The most common symptoms you can have to allergies in general are rashes, itching, swelling, a runny or stuffy nose, sneezing, itchy eyes or itchy nose, watery eyes, and coughing. But if you have asthma and also suffer from inhalant allergies, the symptoms can also include wheezing and shortness of breath. The strongest allergic reaction you can have is called Anaphylaxis or anaphylactic shock, and which is life-threatening. When you enter anaphylactic shock, you can experience itching, difficulty breathing, shortness of breath, tightness in your throat or swelling in your throat and in your tongue, nausea, vomiting, diarrhea, loss of consciousness, anxiety, an abnormal heart rate, headaches, pain in your body in general. So you get the whole package. And I personally really struggle with my allergies to pets and to dust mites because they affect me every single day, right? They're perennial allergies. I take Cetirizine, which is an antihistamine used to lessen the symptoms of inhalant allergies. And usually my symptoms include watery eyes, sneezing, and a runny nose, which, well, doesn't sound that bad, but they can get very annoying, especially because I deal with them on a daily basis. So for me, out of these symptoms, the runny nose is the absolute worst. It really disrupts my focus and makes it hard to get things done when you have to blow your nose every 5 seconds or so, or go in class. I know it's annoying for me, and I know it's annoying for everyone, so I really dislike that. But still, my most serious reaction is to the pollen of flowers, which causes my throat to close up. Here in Guatemala, that's not an issue per se because we don't really have seasons, right? But whenever I encounter someone on the bus or in a classroom or something in a closed space that has flowers, I have to leave before my throat closes up. So my family is not from Guatemala. My mom and her family are Mexican, and my dad and his family are from Spain. So I developed this allergy when I was visiting my dad's side of the family. Usually allergies are developed when you're a kid. It can happen at any age, but it's more common if it happens to you when you're a child. And for me, that was when I was 12 years old. And I remember we visited when the season was like changing from spring to summer, and everything was green and beautiful, and it was, the flowers were in full bloom. And we were taking a walk, and suddenly I realized I was feeling very dizzy and I had difficulty breathing. And for me, having difficulty breathing is more like gradual, so sometimes I feel like I am making it up because it starts very subtly. But by the time we got back to my grandparents' apartment, my throat was almost completely closed up. And well, I honestly can't remember that much because of the lack of oxygen to my brain. But I vividly remember my mom being really scared, and my grandma and my dad were just calming me down, and they handled it all really well. And it's not because they're medics or anything, it's just that my dad is asthmatic, and he's also allergic to pollen, so they know their stuff. And clearly I am fine now, I didn't die, everything went well, and from then on I always carry my inhaler and a mask with me. And if I catch it on time, I just put on the mask, and even though I have difficulty breathing, my throat doesn't close up, which is what's important to me. Thankfully, my allergies are very manageable, and I don't go into anaphylactic shock, so I don't need like an EpiPen or something to pump adrenaline into my system. And I manage my allergies just fine, as I said before, with Cetirizine hydrochloride, which is a really, really tiny pill. And if you suspect you have an allergy, you can book an appointment with an allergist, which is a healthcare provider that specializes in allergies. And they will help you identify which allergens affect you through a test. The most common tests to identify allergies are the skin prick test and blood tests. So I'm sure you're all familiar with blood tests, but what they do in the skin prick test is that they use a tiny needle to inject like different allergens into your skin, and then they check to see how you react. So if you reacted to something, that means you're allergic to that. And although blood tests are easier and they're faster, skin prick tests are more accurate, so you can choose according to your needs. Although allergies don't have a cure, you can lessen their symptoms by using antihistamines and nasal sprays. You can also build tolerance against the allergens that affect you by exposing yourself to them on a daily basis, or by subjecting yourself to immunotherapy, which is like exposing your body to small amounts of the allergens through shots. So that's kind of like a vaccine. This causes you to become desensitized over time, and these are the more long-term relief methods. Hopefully you learned something from this video. Thank you so much for listening.